This episode, we're in Miami, where the Frost Science Museum's aquarium reminds us that what truly matters often happens out of sight.
So, Barry, we talk a lot about these deep lesions in HS, tunnels, kind of deep abscesses. How do they impact patients? Because we like to talk about it, jump to kind of the therapeutics, but how does it really impact patients and in their day-to-day lives?
The first impact they're going to have is pain. They've got constant pain, 24/7, 365. And sometimes they can't even see what's giving them the pain.
Right.
They know it's there, they can point to it, but they can't see it. You know, HS is the worst disease no one's ever heard of and really no one's ever seen. So when you're talking about impact, it has every impact. And patients have a variety of different lesions. Some of them are what we would call papulonodular, the big bumps and the little bumps. And when they explode, they never coalesce. And some people have those very deep-seated, leaking, scarred tunnels, those ant farms, the cave system. Yeah. So impact is everything for them. It determines what they wear in the morning. It determines whether they get up in the morning. It determines whether they can go to work, smell, burn, ooze, sting. It hits every facet of their lives.
I think a lot of times we have these outcome measures, right? We talk about quality of life, but these are like really big words that sometimes we forget what it actually means. So I love how you put it, like, will they get out of bed that morning? And I think it's good to keep in mind that it's really those deep lesions that actually drive what we call quality of life. Anyways, the point is the impact of these lesions, again, is deep on the patients in more than one way.
Absolutely, and with those rating systems, as a dermatologist in private practice, my rating system is, how do you feel today? Are you smiling at me? Are you sitting comfortably? Are you wearing clothes that you'd want to wear? I mean, that, for me, is the biggest staging system.
I think it's really good to keep in mind, both from a patient perspective, but also as a clinician, that you want to go after these lesions, not just to improve a score or to make something look better, but to really impact the patient's lives.
You want to make that patient's life better. That's the goal.
Yeah.
Hadar, you know, when we're looking at HS, maybe people are just seeing what's on the surface, but we know that on the surface, people are looking at this stuff and they're saying, wow, it looks really terrible. But we see that there's a lot deeper involvement. What are you looking at in terms of therapy, superficial versus deep?
Yeah, I think that difference between superficial and deep is really affects my management in multiple layers. But I think as clinicians, I think you will agree that the source of the recurrence is from within deep. We don't see the superficial lesions leading to that recurrence. So we can deroof a tunnel and then maybe a few months later it's coming back. It's never from the epidermis, or at least from that superficial component. It's usually deep in there that we're starting to see something popping out, and the patients will tell us. And that's another very good clue about how important the deep component is. I've had patients that will tell me that they know when a lesion comes. Actually, the other day I had a patient that said, something is coming here. And I looked and I palpated and I couldn't see anything. And I bet you she was right, because this starts really deep and they know it. And so being able to treat the deep lesions really helps us to maybe prevent recurrence and also treat it early before we get that tissue damage.
And we want to give the patients the trust that when they come to us and they say, I feel something coming up, we believe them.
Dermatologists are smart, just as smart as any other doctor, but the one skill we do really good is examine the skin. And if you don't take time to do that with a patient with HS, you may miss important clues. And one of those is the level of inflammation, how strong it is, but also how deep it goes. And so I really recommend to all my trainees, get the patients in a gown, really examine all the areas that are affected so you can get a sense of how the disease, how widespread it is or not. And usually I find at least one more area, and I don't know if it happens to you, but the patient comes in and complains, oh, I have a thing in the right armpit, right? And then you say, let's look at the whole skin. When I think about how deep the lesions are, you coined this term about the ant farms, and I think that's a very good way to think about it. But my understanding of these lesions over time has evolved, and I think they're more like deep cave systems. They go in, there's like narrow places, they go wide, and I think it's good for clinicians and patients to understand that sometimes, like you say, it's not just that area that's painful, it may be more the induration around that fibrosis that we feel, those scars that maybe are not so visible from the top, but when you palpate, you can appreciate that. And to me, that's something that I'm trying to communicate to the patients, both from my experience seeing this going through over the years, so maybe you will see it in the future, but I can tell you right now that this is not stopping, this is going. And that brings it back to the whole idea of needing to control that inflammation. But I think your surgical perspective is so helpful, not just for the patients and the outcomes that you provide, of course, but also for clinicians to think, wow, I need to think about this because if I were to cut this whole thing out, I would probably underestimate. And there's data to support this, hands down, that we always underestimate the disease. So I think it's really key to clinicians to not be afraid, to understand this is a severe disease of the skin, but still can be very severe, and we need to attack it with multiple modalities.
Absolutely. It is the veritable tip of the iceberg all the time.
Tip of the iceberg, I like that.
Hadar, this has really been a great experience. Being in a place where they focus on what's beneath the surface, what's deep, and we're talking about HS and how we really think clinicians and patients need to see below the surface of the disease to get the best outcomes.
Yeah, I'm really grateful to being able to catch up with you and see you again and talk about this disease that I think we're both and our colleagues are very passionate about to bring good care in this space. I don't know, there's something inspiring about going under the water, under these animals that are kind of hovering above us, and really think how deep this disease can really go.
I agree.